There's no multivitamin. There's nothing that you can buy at Authentic Health. There's nothing that Dr. Rhonda Patrick can recommend. There is nothing you can go buy off a shelf and put into your mouth that will do for you what exercise will. Multivitamins appear to have no effect on total cancer incidence or several types of cancers, including breast, colorectal, prostate, or skin melanoma. Although the risk of lung cancer was 38% lower for participants take a multivitamin. Hey there, folks. Welcome to the Healthy CEO Show. I'm Jason Wright, and I am the Healthy CEO. I am the co-founder and CEO of Authentic Health Partners. And today I want to talk to you about multivitamins. I just received an email from Dr. Rhonda Patrick. That's right. It was so kind of her to email me on this topic, me and about 1 million other people that subscribe to her newsletter. And the topic was multivitamins. Essentially, are they worth it? And, you know, I get this question a lot. One, because I happen to be in the nutraceutical business, but also just as a health and wellness figure, person, whatever, people want to know, should I take a multivitamin? If I should, or if I do, which one should I take? And this obviously piqued my interest whenever Rhonda Patrick sent out to her email list an email titled, "Are multivitamins really useless for longevity?" I know a lot of people think that multivitamins are nothing but creators of really expensive urine. So the question becomes, well, if that's the case, is there even any benefit at all to taking a multivitamin? But more importantly, is it possible that a multivitamin could cause me harm? Well, whenever I got this, I thought this would be an excellent email to go through and bring to the Healthy CEO Show audience, just because it answers, in my opinion, she very succinctly answers this question in a way that should give all of you some guidance. And of course, I agree 100% with what Dr. Patrick says on this topic. And so I thought what we would do is just go through this. And I'm also going to tie into it I wish I had my business partner, Dr. Gus Vickery, with me here, because so much of what she says as to the reasons why you might want to consider a multivitamin are the reasons why Dr. Vickery developed our foundational stack of supplements, F1, F2, F3, which you can get at shopauthentichealth.com, which is F1, the essential nutrients, F2, which is the essential fats, and then F3, essential amino acids. That was developed because of the data that Dr. Rhonda Patrick talks about in this email. So let's just jump right into it. All right. Micronutrient deficiencies are widespread. Up to 70% of Americans don't get enough vitamin D, nearly 50% fall short of their magnesium needs, and 35% have an insufficient intake of calcium. So let's just stop right there for a minute. One of the things that you have to think about, and it sounds so obvious, I know, but whenever you hear people say, should I take supplements? Or when we talk about supplements in general, we tend to forget what the word supplement means, right? It's to supplement something else that you're not getting enough of. And most people, according to what Dr. Patrick is saying here, 70% of Americans don't get enough vitamin D, 50% fall short of magnesium, and 35% have insufficient intake of calcium. A lot of people hear that and they'll go out and they'll buy those individual supplements in bottles. And what they'll do is they'll take like this heavy dose of just magnesium, of just vitamin D, or just calcium, and they may not even really get the impact they're looking for. They may just completely overshoot. Either way, the bottom line is this. You may not need to take those individually. You might need to get them just in the form of a multivitamin where it's a little bit more balanced. So I'm going to continue. These deficiencies or insufficiencies ravage our health. Inadequate vitamin D increases mortality risk. A magnesium deficiency can accelerate biological aging. Folate deficiency by itself can produce a level of DNA damage that is equivalent to or in excess of an acute exposure to radiation, although this occurs at levels uncommonly seen in human populations. Addressing these deficiencies seem to hold a remarkable benefit. For example, correcting vitamin D and magnesium deficiencies can reverse epigenetic aging and protect against DNA damage. I believe that diet should be the primary source of most our nutrients, but it can be hard to obtain optimal nutrition through whole food sources. Let's pause right there. She's 100% correct. And again, it goes back to why Dr. Vickery developed our supplement stack. And I refer back to Dr. Vickery, not just because I want this to be one big, long commercial for Shop Authentic Health. What I want to do is just help you to understand that Rhonda Patrick, who is a PhD, versus Dr. Vickery, who is an MD, they both converge on the exact same page on this topic, which is that most of our foods do not have the nutrient-rich density that we need, even if you eat organic. Now, eating organic will definitely level up your nutritional intake. However, it's still sometimes not enough based on your epigenetics, how your whatever, and that's just a big word for saying your genetics, okay? You may have a genetic deficiency in your vitamin A production or whatever. So what you have to do is figure out ways to supplement that. Now, I'll say this before we even go any further. If you really want to drill down and understand whether or not you're deficient and whether you should take a multivitamin or you should just take one or two supplements, whatever the case may be, the best thing to do is go get your blood work done. I say it all the time. You'll never know where you're going if you don't know where you currently are. And I think, and look, it's not as difficult and or expensive as a lot of people think. And there's also different levels of blood screenings and blood panels. The one that we use at Authentic Health in our clinic in North Carolina, in Asheville, is a prodrone kit where you basically just have a phlebotomist come to your house, draw your blood, you send it off, it gets reported back to Dr. Vickery or Dr. Jackson or one of our health coaches. And there's two primary things that you're going to see on these reports. One, you're going to see the presence of the vitamin that we're evaluating in the blood serum. Okay, that's important. You know that there's a presence of vitamin A. But here's the cool thing, and here's the thing that you need to do before you ever really start asking these questions about multivitamins or supplementation is how much of that vitamin A is actually getting into the cell. So the reports that Dr. Vickery and Dr. Jackson work from, they're going to show you both things. They're going to show you your serum levels as well as your cellular level of this vitamin. Dr. Gus and I have actually gone through multiple blood panels, and he's explained this so that you can actually see in real time. So you might want to check back on some older episodes to see that. But the point is, this is what you need to do. You need to find out where you are and then try to get as much of your nutrients and your vitamins from whole foods. And I say this as someone who does not sell food, but does sell supplements, that I would tell anybody the first thing you should ever do before you shop AuthenticHealth.com is you should make sure you have a nutrient-rich diet, you get your blood panels done, and you try to get some idea of where you are starting. I always recommend that people do that. All right, so let's continue. In light of this, the benefit of a multivitamin seems clear. The downside is low when you consider the overall benefit of potentially shoring up highly individual minor nutritional deficiencies. And the notion that multivitamins have some benefit is shared by many. Around 1/3 of adults report that they take a multivitamin. That's a lot. That's more than I thought, actually. A health investment or expensive urine, right? The age-old question, am I just creating really expensive urine? Most people take a multivitamin in hopes of preventing disease and delaying death. If something as simple as a multivitamin can help with either of these goals, it's worth knowing. But some people will tell you that multivitamins are useless, that they are just creating more expensive urine, at least for those with a well-balanced diet. Multivitamins improve cognition. This is Dr. Patrick. I don't share this view. In addition to the potential benefits of multivitamins for preventing conditions like anemia, neural tube defects, cataracts, and osteoporosis, there is convincing evidence from randomized controlled trials that supplementing with a daily multivitamin improves brain health and cognition. In a 3-year study known as the COSMOS, the COA Big CO, little COA supplement and multivitamin outcome study. Taking a multivitamin improved cognitive function, memory, and executive function compared to a placebo. A meta-analysis of 3 Cosmos subsidies concluded something similar. There was clear evidence that multivitamin supplementation improved global cognition and memory, an effect that was estimated to be equivalent to a 2-year reduction in aging. Pretty significant. Now let's look at multivitamins and mortality. When it comes to major diseases and mortality, the data aren't as clear or convincing. Multivitamins don't seem to reduce risk of cardiovascular disease, cancer, or all-cause mortality. However, you know what absolutely does? This is me, not Dr. Patrick. What absolutely does reduce, sometimes by as much as a factor of 4x, 4 times, what can actually reduce all forms of mortality: exercise. Raising your VO2 max into the top 25%, doing movement, actually exercising. There is no multivitamin. There's nothing that you can buy at Authentic Health. There's nothing that Dr. Rhonda Patrick can recommend. There is nothing you can go buy off a shelf and put into your mouth that will do for you what exercise will. Back to the email. Multivitamins appear to have no effect on total cancer incidence or several types of cancers, including breast, colorectal, prostate, or skin melanoma. Although the risk of lung cancer was 38% lower for participants taking a multivitamin. That's interesting. These conclusions seem to hinge on a lack of evidence that prevents a balance of the benefits and harms from being determined. In my view, multivitamins don't need an overwhelming standard of evidence for a large benefit because the overall evidence that each of us may have individual minor nutritional deficiencies is strong. So basically what she's saying there is this. Again, it goes back to what Dr. Gus found in his clinic. Almost universally, we are all deficient somewhere in our vitamin intake. Every single one of us, even somebody like the healthy CEO, me. I mean, I do everything I possibly can, but I'm still going to have some deficiencies that could probably be supplemented with a multivitamin or, in my case, the Authentic Health Foundational Stack. All right? So let's continue. But what if there was even a slim chance multivitamins were actually harmful? A new study asserts just that, finding that people who reported taking a multivitamin every day had a 4% increase in all-cause mortality risk and a 6% increase in heart disease mortality risk compared to non-users. Taking a multivitamin less than daily was associated with a 9% increase in all-cause mortality risk compared to non-users at a 12-year follow-up. Taking a multivitamin was not associated with a greater or lower risk for cancer or cardiovascular disease, nor was it associated with mortality from all causes or specific causes after 15 years or more follow-up. Let's break it down. Published in JAMA, entitled Multivitamin Use and Mortality Risk in 3 Prospective U.S. Cohorts, this new study attempted to more rigorously assess the link between multivitamin use and mortality by addressing some of the biases that have been present in previous observational studies, namely the healthy user bias and the sick user effect. So that's one of the things that we have to always look at whenever they do these trials is you want to know the habits of the people that are being researched. Like whenever you find out that there was one here that was done recently that got a lot of attention about red meat leading to type 2 diabetes. What it did not tell us is that, okay, so all these people that eat red meat that have an increased likelihood of developing type 2 diabetes, what are their other habits? Do they exercise? Do they eat clean? Is it lean red meat? Do they drink alcohol? What are the other things that they do? So you've always got to understand what exactly it is, because remember, correlation does not indicate causation. That's one of the things that we know. And so just something to always be aware of whenever you're reading these studies. To control for the sick user effect, the possibility that people who get sick will then start using a multivitamin, making them less healthy than non-users, any participant who had cardiovascular disease, cancer, diabetes, or kidney disease at baseline was excluded. Very good. So in other words, how many people do you know that they get sick, they have something bad happens, then all of a sudden they start taking vitamins? Well, those people were kicked out. This was only people that just were functioning normally, didn't have all these other problems, and were also taking multivitamins. A total of 390,124 participants were pulled from 3 large prospective cohort studies. The participants were asked at least once whether or not they used a multivitamin and were then separated into one of 3 groups based on their answer. Daily multivitamin users was 163,307, non-daily multivitamin users 47,151, complete non-users 179,666. The participants were followed for a median of 23 years, during which deaths from all causes, heart disease, cancer, and cardiovascular disease were recorded at 2 time points: the first 12 years, follow-up number 1, and 15 years and beyond, follow-up number 2. So that asks the question, is daily supplementation risky? During follow-up period number 1, people who used multivitamins daily had a 4% greater risk for all-cause mortality than people who never used multivitamins, while people who used multivitamins less than daily had a 9% increase in all-cause mortality. No differences in all-cause mortality were observed during the second follow-up period, which was 15 years or more after the baseline assessment. Other than heart disease mortality, the rate of which was 6% higher in daily users compared to non-users during the first 12 years of follow-up, there were no significant differences between multivitamin users and non-users in the risk of dying from heart disease, cancer, or cardiovascular disease. The same was true for non-daily users versus non-users. In other words, taking a multivitamin wasn't associated with protection against dying from these diseases, but it also wasn't associated with any harm either. The researchers also conducted an analysis that included a second assessment in which participants indicated their multivitamin use on average 6 years after their baseline assessment. This is important because it's a better indicator of multivitamin use over time than a single assessment at baseline. It helps to control for multivitamin use habits that may have changed during the study. What was the result? A similar finding to the first analysis, a 4% greater cause in all mortality risk in daily multivitamin users in the first 12 years of follow-up, and no difference in all-cause or cause-specific mortality at the 15-year and beyond follow-up. One more reason to question these results. The hazard ratios of these outcomes were all very close to 1. An HR compares the likelihood of an event, such as heart disease or death, happening in one group compared to another. If the HR is 1, it means the risk is the same in both groups. If the HR is above 1, the risk is higher in the first group. If it's below 1, the risk is lower. An HR close to 1 means that the risk of the events happening was nearly the same for both multivitamin users and non-users. For example, the hazard ratio of 1.04 for all-cause mortality in daily vitamin users indicates a very small increase in risk. However, this increase is quite weak, and the confidence interval 1.02 to 1.07 shows the result is very close to no difference between the groups. The increased risk is likely due to some as yet unidentified factors that were different between multivitamin users and non-users, or perhaps it was a mere statistical artifact. Final thoughts. Of all this probably has you wondering, should I take a multivitamin or not? Yes, Dr. Patrick, that's what we want to know. All right. This is what she says. I believe that most people should take a multivitamin as a means of nutritional insurance and to obtain micronutrients that might be harder to get from food. Amen. Preach, sister. I agree. If you're currently taking a multivitamin, don't stop based on the results of this study. There's an enormous difference between multivitamins not being tied to improved longevity and multivitamins being tied to reduced longevity. I think this study confirms the former. An emphasis on the latter is just a useless distraction. Multivitamins may be benign, but they're unlikely to be harmful. What's important to remember is that exercise, sleep, and diet are exponentially more important for your longevity, whether or not you take a multivitamin. Make sure you have these low-hanging fruit taken care of before you begin to worry about the smaller, albeit still important, lifestyle inputs. At the end of the day, if you're worrying about whether taking a multivitamin is shortening your lifespan, you're worrying about the wrong things. Don't let misleading headlines about studies steer you away from what really matters for your health. I think that is absolutely 100% spot on, as Dr. Patrick always is. And so I would just tell you this. One of the things that she kind of puts in there that I've already alluded to is this. You got to move. You got to move. You got to exercise your body. There's nothing you're going to find in a bottle. There's nothing you're going to find on a shelf. There's no serum. There's nothing that's going to compare with getting up and going for walks and exercising and trying to increase your VO2 max, increase your lean body mass, and then make sure you eat the highest quality foods possible. Look, I think it's something that every family should do, especially if you have children. And and this is one of the reasons why I thought the timing of this was perfect. We just had a congressional hearing yesterday, as the time I'm recording this, on these big food produced things with these highly processed foods and the damage it's doing with the dyes. I haven't even seen it yet. I just listened to it on a news clip on a podcast earlier. I want to go watch the clip and probably put it on here. Maybe I'll tuck it in here as I'm talking about it. But apparently one of the physicians that was testifying had a bowl of Fruit Loops from Canada versus a bowl of Fruit Loops from the United States of America. Well, the ones from the US were just bursting with color, bright, and the ones from Canada look kind of drab. The reason being the dyes and the things that make the color so bright in the American ones are not allowed in Canada. Now, there's very rare occasions where I'll say Canada is doing something better, especially when it comes to regulation, than America. But these are things we've got to start looking at. So here's the thing you got to remember. Again, especially those of you who have kids. It's not just that our food is lacking in nutrients. A lot of the things that we are eating has added poisons and just artificial ingredients that are just terrible and toxic and wreaking havoc on our bodies. So that's a double whammy. You're not getting the natural nutrients that you need, and you're also getting toxins that you absolutely don't want at any cost. So supplementation is a great way to combat against this. I highly recommend that you please consider going out to shopauthentic.health.com and looking at the foundational formula. Look, if you take a multivitamin, as Dr. Patrick says, there's no reason to stop. You're probably deficient, and it's probably helping you overcome some of those deficiencies, so keep doing it. But if you want to level up, and if you want to go from a standard multivitamin and you want to get rid of all the other bottles, then consider going to shopauthentic.health.com and look at the stack that Dr. Vickery has developed. He went into it with the mission of trying to fill those gaps that he kept seeing in patient after patient after patient, over 1,000 case studies, to determine what most people, after reviewing their blood work, were deficient in and how to make up for that. When he did that, he created this 3-stack formulation, this 1-stack formulation of 3 different supplements that include your essential nutrients, your essential fats, and your essential amino acids. You can go to shopauthentic.health.com. You can read all about it. You can see how Dr. Gus conceived of this stack, and you can throw the rest of the stuff away, go get your blood work done, and then start just precisely filling those deficits in due to your epigenetic makeup, due to your lifestyle, due to some of the things that maybe you have to eat or other medicines you have to take that sometimes can actually have an impact on the vitamins that are in minerals that are in your body. So go take a look. I hope you will. And that's all I've got. It's so good to. So that's it for today. Thank you so much for listening to The Healthy CEO. I'm Jason, and I'm out.
The content provided in this podcast, The Healthy CEO, is for informational and educational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The opinions expressed by our hosts and guests are their own and do not necessarily reflect the views of the Healthy CEO. Any information provided by our hosts or guests, including any physicians who may appear on the podcast, is solely for informational purposes and does not create any doctor-patient relationship. Listeners are advised to consult with their healthcare providers before making any changes to their health routines. The Healthy CEO and its affiliates assume no responsibility or liability for any consequence resulting directly or indirectly from any action or inaction you take based on the information provided in this podcast.